for watching Living Local with us this morning. I'm here with Dr. Nguyen. How are you?
I'm doing fine this morning. How are you?
I'm doing well, thank you. So it's Breast Cancer Awareness Month, and so we are kind of talking about all the signs and symptoms and when to get checked.
You know, breast cancer is the #1 diagnosed type of cancer in America
Is it?
among women. So therefore, it's very important. And I'm glad that I have this opportunity to discuss about this very important disease.
And do men get it too, or is it just women?
Men get it too, yes.
They do, okay.
Almost 3,000 cases has happened in 2019 among men.
Wow.
Yeah.
And is there screening you can do to see if you have kind of the genetic history for that?
Yeah, so a lot of times it's by taking a history. So
Okay.
that's why, we usually kind of talk about their family tree and see who among their family members who might have had breast cancer and how closely they're related. And there's certainly genetic testing that we do too, because there's this one entity called hereditary breast and ovarian cancer syndrome, and this is often associated with a genetic mutation such as BRCA1 and 2. So this is actually a genetic mutation that can be passed down from generation to generation.
Wow.
And women who have confirmed BRCA mutation would have up to 80% of lifetime risk of having cancer. So their screening protocol actually begins at a very early age. For most women, in terms of the standard risk, for majority of our women, we recommend our women between the age of 40 to 44 to start having that conversation with their primary care providers.
And we actually have Dr. Conwell who's going to give us a little more insight on that.
We recommend that women begin screening mammograms at age 40, and then every year, and so long as they remain healthy and are willing and able to undergo treatment for breast cancer. Now, the one caveat to that is if women have a family history of breast cancer, we recommend that they start screening 10 years prior to a first-degree relative. So for example, if a first-degree relative developed breast cancer at age 44, we'd recommend that woman start screening at age 34. So 1 in 8 women in their lifetime is a very often quoted statistic, which is correct and is accurate. The best statistics that we have about mortality reduction is if a woman participates in screening mammogram every year, she can expect a 40% reduction in mortality due to breast cancer, which is amazing.
You know, we were talking before we started rolling, and the question came up about, can people with breast implants do this test? Is that something that they can do?
Oh yes, definitely, yeah.
Okay.
Women with breast implant can get
They can still have the
they can still have the
compression.
compression, they can still get the mammography. I mean, there's some thought of whether that can cause a rupture and everything, but usually that is not the case.
It's not the case.
Usually during the imaging questionnaire, that would be some of the questions they can go through.
And there was also the question of, does breast implants increase the chance of breast cancer?
Yeah, that's an excellent question because, obviously, that's one of the things that can definitely worry a lot of women. And the answer to that is no. I mean, there's no data to support that. The common question here is about self-examination. And I think it's dated back to, many years ago where the conventional thought is that women should do a self-examination, at least on a yearly basis or check themselves all the time. But, we actually having more data and say that that may not be as helpful. I think the whole idea is we should be, comfortable and should be aware of the body, anything changes. So if you notice any kind of a skin change, any kind of dimming of the breast or any kind of architectural distortion, you should definitely seek out help. But in general, we recommend a breast examination by a professional. When you do the examination, there are certain techniques that we do in order to help or increase the chance to be able to palpate one of those lesions.
But early detection is also really important, right?
Definitely, yeah. When it comes to breast cancer in the early stage, definitely highly curable, and the treatment would also not too involve, because there are different treatment modalities that we use, whether surgery, radiation, chemotherapy, hormonal therapy, even immunotherapy, which is one of the new, advanced treatment that we start having. But the early that the breast cancer is detected, the more likelihood that will be cured, and also involve less treatment modalities as well.